Listen carefully. Okay. Now, observe this particular diagram, which you can see. Observe this particular diagram. Now, there is a graph which is given. Yes or no?
Yes, sir.
So 0 milliseconds, 100 milliseconds, 200 milliseconds, 300 milliseconds, 400. Okay. Now, if you see this particular SA node, where it is being activated, 0.1 second, 0.01 second, 0.25 seconds, 0.50 seconds, 1.5 seconds. Millisecond, all these are what, ma?
Milliseconds.
All these are?
Milliseconds.
So exactly what are these milliseconds? What is this cardiac cycle? How to read an ECG? We'll look in the coming slides. Okay, next slide, please. Now see. So when sinoatrial node is activated, when SA node is activated, you can see the yellow graph. Immediately, see here, these are the millisecond ranges. So approximately 0.025, you can see here. If I'm visible, you can see here. Next, what is the atrial? How when the atrial muscle is excited means between 0.25 to 1 millisecond. 1
Millisecond.
Yes or no? Yes or no? Now, here if you see, then the AV node is activated. AV node is activated. So, at what time AV node is activated? Now, again, QRS complex is starting. So, when the QRX complex is started actually? So, QRX complex is started with the ventricular muscle excitation. Ventricular muscle? Yes or no? Yes or no? Yes or no?
Yes, sir.
Again, when the Purkinje fibers are started, when the ventricular muscle is starting, okay, when the common bundle is started. What is the common bundle? Here, between the atrium and between the ventricles, if you can see clear difference here. The green are atrium. These four are pulmonary veins which are being opened into right arm. Left. These are the superior vena, inferior vena, and behind we have coronary sinus. Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
This is what. And this is the time taken. This was the time. So when the Q wave is starting, when the R wave is starting, when the S wave is starting, when the T wave is starting. Am I clear? Next one. What's the back column? Can you see the color coding?
Yes, sir.
Can you see the color coding? Can you see at what time, what type of node, when the sinoatrial node is excited, when the atrial muscle is excited, when the AV node is excited, when the common bundle is excited, when the bundle branches are excited, when the Purkinje fibers are excited, when the left ventricular muscle is excited. Am I clear? Yes or no? Approximately it is stopping near the 600 milliseconds. 600 milliseconds. Clear? This is what? This is sinoatrial node, which is there in the right atrium. These three are what? Internodal pathways. These three are internodal pathways. This is AV node. This was AV node near the tricuspid wall. Near the tricuspid wall. This is the common bundle. Common bundle of his which is there between the atrium and ventricle. Now, this is the muscular ring. There is a muscular ring where atrioventricular ring is there. From there, it is divided into two types: right bundle branch and left bundle branch. From right bundle branch and left bundle branch, it is divided into another further extending, which are called as Purkinje fibers. Which are called as Purkinje fibers. Next one. So, what is the heart physiology? What is the heart physiology? So here the time which is taken in milliseconds. The time which is taken in
Milliseconds.
So now this Ca2 permeability is sodium, calcium and potassium. Potassium permeability is decreasing and calcium permeability is
Increasing.
Do you get my point? Yes or no?
Yes, sir.
So when channels open, when fast channels open, what is happening here? Now again, calcium permeability is decreasing, potassium permeability is.
Increasing.
So here, this is nothing but the intrinsic conducting system. This is nothing but the intrinsic conducting system. Now, this is not there in your syllabus. We are going as per BSc level, some further level. But for GNM, we do not actually need this intrinsic part. Okay, come next slide. What is it? Now, heart physiology. What is the sequence of excitation? What is the sequence of excitation? Which part is excited first? Now, listen to me. Sinoatrial node generates impulses about 75 times per minute. How many times per? 75 times. Average. This is what? Average. So what we have said 60 to 100 per minute. 60 to 100 per minute. So average we can take it as 70 per. Now atrioventricular node. What ma? Atrioventricular node delays the impulses approximately 0.1 second. Delays approximately 0.1 second. Impulse passes from atria to ventricle via atrioventricular bundle, which is called as bundle of Fish. Next slide. Now, every bundle splits into two pathways in the interventricular septum between the ventricles, which we have seen in the picture. Bundle of branches. Now, bundle branches carry the impulse towards the apex of the heart. Towards the apex of the heart. Now, apex of the heart is inferior or posterior? Inferior and posterior side of the heart. Anterior side of the heart. Anterior side of the heart. Next one. Purkinje fibers carry the impulse to the heart apex and the ventricular. Next. So you can see electrocardiography, otherwise called as ECG or ECG. Okay. Electrical activity is recorded by electrocardiogram. We call it as electrocardiogram, otherwise called as ECG or EKG. Otherwise called as ECG or EKG. Now, P wave corresponds to the depolarization of SA node. P wave corresponds to the depolarization of SA node. Now, QRS complex corresponds with the ventricular depolarization. Corresponds with the ventricular depolarization. T wave corresponds to the ventricular repolarization. Ventricular repolarization. Now, atrial repolarization is located and is masked by larger QRS complex. Larger QRS complex. So, when the atrium is being contracted, when the impulse is present in the atrium, P wave is corresponding. Now, P wave shows us the contraction patterns in the atrium. Which wave is showing? P wave. Which wave is showing? Connect. So here, can you see this particular picture?
Yes,
so this is showing us P wave. So what color it is there?
Green.
What color is here?
Green.
Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
At the same time, when the P wave is ending, before the P wave ends, there are other parts are also which are getting excited. AB node is getting excited, as well as common bundle is getting excited, as well as bundle branches are also starting to get excitement. So P wave is showing us the atrial node. P wave corresponds to the depolarization of SA node. Now, QRS corresponds to the ventricular depolarization. Ventricular depolarization. So, we can show. ventricular depolarization. So when you see here Q, ventricles color check చేసుకోండి. ఇక్కడ QRS complex color check చేసుకోండి. Okay, ventricles when they are exciting, when the impulse is passing through ventricles, this QRS complex is. Now what is this T wave means? Relaxation. It is corresponding with the relaxation of ventricle. Sir, when you said AV node is contracting, the contracting is shown in P wave, that is fine. What is this? It's SA node. So both when the atrium are contracting, we have seen in the P wave. So depolarization is seen. Where is repolarization gone? Repolarization will, now they are contracting means they have to relax.
Yes.
They have to relax. But where is that relax in the graph means it is masked by this QRS complex. It is masked by this
QRS complex.
That means because the QRS complex is little larger when compared to this atrium, here this particular portion when it is getting relaxed, the impulse is masked by the ventricles. The impulse is masked by the
Ventricles.
Am I clear? Am I clear? Yes or no?
Yes, sir.
So when the atriums are contracting, P wave we can see when the QRS complex is present, we can talk about the ventricles. We can talk about the ventricles. This P wave indicates the relaxation of ventricles, the repolarization of ventricles. Okay, come. Atrial repolarization record is masked by larger QRS.
Complex.
Larger QRS.
Complex.
Am I clear? Am I clear? Next. This is what. So you can see the atrial depolarization. You can see what one? Atrial depolarization. Now atrial depolarization is explained by which wave?
P
P wave. What is explaining us atrial depolarization?
P wave.
What is explaining?
P wave.
So how many waves are present in a ECG? P, Q, R, S, T. P, Q, R, S, T. Innamma? 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Now P wave is concerned with the atrial depolarization. Is concerned with the atrial
Depolarization.
Now QRS complex is concerned with the ventricular depolarization. Ventricular
Depolarization.
and P wave is concerned with the ventricular repolarization. Ventricular
Repolarization.
Now if you see the atrial depolarization occurs between 0.0 to 0.2 seconds. 0 to 0.2 seconds. P wave is between, what is the interval between P wave and Q wave? 0.2 seconds. 0.2 seconds. Now at the beginning of the P wave, atrial depolarization started. At the beginning of Q wave, atrial depolarization ended. Atrial repolarization will begin. Atrial repolarization. Listen carefully. Contraction and depolarization anukundam. Relaxation and repolarization anukundam. Now, at the beginning of the P wave, atrial depolarization is beginning. Atrial depolarization is beginning. At the beginning of Q wave, atrial repolarization begins. If atrial repolarization is beginning, that means the depolarization phase has ended. Depolarization phase has ended. Am I clear? Am I clear? Yes or no?
Yes, sir.
Contract అయిన తర్వాత ఏం అవ్వాలి?
Relax, sir.
Contract అయిన తర్వాత ఏం కావాలి?
Relax.
एक बार contract हुआ तो क्या होना है बाद में?
Relax.
So this P wave indicates to atrial depolarization. यहाँ पे और एक wave आना है. ఇక్కడ ఏం రావాలమ్మా ఇంకొక వేవ్ రావాలి కానీ that wave is masked by the QRS complex. By the time the atrium is relaxing, the ventricles are
Contraction.
atrium relaxing, the ventricles ఏమవుతాయి?
Contraction.
Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
So when the ventricles are relaxing, contracting, impulse is more in the ventricle. So when you are taking ECG, this impulse, atrial repolarization impulse is masked by the ventricular depolarization impulse. That's why QRS complex we can see only the ventricular depolarization. We can see only the ventricular
Depolarization.
Am I clear?
Yes, sir.
Am I clear?
Yes, sir.
Now, what is this ST segment? What is this?
ST segment.
So, by the beginning of T wave, ventricular depolarization stops and ventricular repolarization begins. Ventricular repolarization
Begins.
Did you get my point? So, at P wave starting, atrial depolarization is there. Q wave starting, atrial repolarization started and ventricular depolarization started. Now, ventricular depolarization is between Q and S. So, ventricle, if there is any problem in the ventricle, this QRS complex will vary. This QRS complex will.
Vary.
Am I clear?
Yes, sir.
Am I clear? This particular QRS complex will. Either the waves are peaked high or the waves are inverted or the waves are low or the waves are
Low.
so there is a graph setting. There is a graph setting, and this R wave has to be to reach to that exact graph. If it is going beyond the line, there is some contraction problem. If it is coming below the line, there is some contraction problem. Can we understand? Can we understand? Now, any changes in the QRS complex will indicate the problem with the ventricular depolarization. Ventricular
Depolarization.
Now, any changes with the P wave will indicate as the problems with the atrial depolarization. Atrial
Depolarization.
P wave is indicating atrial depolarization and QRS wave is indicating ventricular depolarization. Ventricular
Depolarization.
and T wave is indicating ventricular.
Depolarization.
You can see the time interval. Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
Now T wave from if you take the T wave, it is starting. It is beginning at like 0. If you take 0.5 seconds, if you take 0.5 seconds, it is just like milliseconds. Within milliseconds, 0.2 to 0.3 seconds, it is getting finished. Yes or no? Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
So here, PQ interval is 0.2 seconds. PQ interval is about 0.2 seconds. Now, the time between Q wave, P wave and T wave. The time between the P wave and T wave is about 0.6 seconds. Is about 0.6 seconds. Am I clear? Am I clear?
Yes, sir.
Yes or no?
Yes, sir.
Next one. Now, what is this essay? What is this? Now, sinoatrial node will generate impulse. That means excitation is begin in the SA node. Excitation is begin in the SA node. We know what is the region, what is the location of SA node. In previous class we have discussed. Yes or no? Yes or no?
Yes, sir.
So in between the superior vena cava and atrium, at the junction of superior vena cava and atrium, posterior of the heart, SA node is present. SA node is
Present.
It is there or not?
Yes, sir.
Now, when the impulse is starting in SA node, P wave got activated. P wave got what?
Activated.
So, when the impulse is reached entirely to the atrium, entirely to the atrium, entire P wave is covered. Can you see here?
Yes, sir.
Entire P wave is covered. Now, AV node will delay the impulse. AV node will delay what?
Impulse.
So that it is spread evenly and the contraction occurs by the time ventricles are relaxing. They are emptying the blood to the semilunar valves. Through the
Semilunar valves.
What are the semilunar valves? Pulmonary semilunar valve is a aortic semilunar. Now, right ventricle is emptying to pulmonary semilunar valve. Left ventricle is emptying to aortic semilunar. Am I clear?
Yes, sir.
Am I clear?
Yes, sir.
Yes or no?
Yes, sir.
Yeah, please listen. Now, impulse passes to heart apex and the ventricular excitation begins. Impulse is passing to where, ma? Apex of the heart. Apex of the heart. Now, from bundle of this, the impulse is passed to apex of the heart. From here, From apex of the heart, what happens? The excitation of ventricles will begin. The excitation of so ventricles excitation will start although it won't start from atrioventricular septum. It will start from apex of the heart. It will start from
Apex of the heart.
because heart has to contract here and the blood has to be entered like this. Yes or no? Yes or no? Do you get my point? Yes or no?
Yes, sir.
Where the semilunar valves are present? Behind, near the bicuspid valve. Where the semilunar valves, pulmonary semilunar valves are present?
Tricuspid.
Near the tricuspid. Yes or no?
Yes, sir.
We have discussed the valves of heart.
Yes, sir.
Yes or no? We said four types of valve will be there: tricuspid valve and pulmonary semilunar valve, bicuspid valve and aortic semilunar valve. Yes or no?
Yes,
So
sir.
like this, the bundle of branches. This is where the QRS complex will begin. This is where the QRS. So when the impulse reaches the apex, the Q wave starts to begin. The Q wave starts to.
Beginning.
Now when the impulse is reached entirely to the, so they start in the near the apex of the heart. Where it is ending? Near the atrioventricular septums, atrioventricular groove. Atrioventricular
Groove.
Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
You can see the yellow part. Purkinje fibers or Purkinje fibers are excited, entire ventricular excitation is completed. By the time entire ventricular excitation complete, QRS complex is finished. You see here, QRS complex is done. Am I clear?
Yes, sir.
Am I clear?
Yes, sir.
Yes or no?
Yes, sir.
Next. Now, this is where. So, heart is stimulated by sympathetic cardio-acceleratory center. What ma? Sympathetic cardio-acceleratory center. Heart is inhibited by parasympathetic cardio-inhibitory center. Heart is inhibited by
Parasympathetic cardio-inhibitory center.
cardio-inhibitory. Now, here we have cardio-axillary center. Where it is there? It is there in the medulla oblongata. It is there in the medulla oblongata. So, whatever the cardio-axillary center is there, it is activating sympathetic chain of ganglion. It is activating sympathetic chain of ganglion. So, from sympathetic chain of ganglion, the impulse is transferred. The impulse is transferred. How it is transferred? Now you can see here. This is the thoracic spinal cord. Thoracic spine. From medulla oblongata, from brain, spinal cord is exciting or not? Yes or no? So in vertebral column, spinal cord is present. So spinal cord is giving rise to different types of what you call nerves, spinal nerves, different kinds of spinal nerves. Now from spinal nerves, it is the wave is entered like sympathetic cardiac nerve. The impulse is carried out to SA node, AV node, bundle of his and Purkinje node. SA node is getting impulse, AV node is getting impulse, bundle of is getting impulse, and Purkinje fibers are also getting
Impulse.
So SA node rate is higher, AV node is rate is little lower, bundle of is rate is also little lower, whereas the Purkinje fibers rate is also very low, 20 per minute. But what is their conduction capacity of the Purkinje fibers are higher. It's about 4 meter per
Second.
4 meter per
Second.
It's about 4 meter per
Second.
Am I clear?
Yes, sir.
Am I clear?
Yes, sir.
Next. So what is cardiac cell? What is?
Cardiac.
Now we know what wave. See, when atrium depolarization is beginning, when the atrium depolarization is beginning, which kind of wave is getting excited? P wave is getting excited. P wave is getting excited. When ventricular is beginning, when ventricular depolarization is beginning, what wave is excited? QRS complex. What is getting excited? QRS complex. QRS.
Complex.
When ventricular repolarization is beginning, when ventricular repolarization is beginning, what wave is getting excited? T wave. What wave is getting excited?
P wave.
You get my point? Yes, sir. Then what happened to atrial repolarization? It is masked under, don't put mark. It is masked under QRS complex. It is masked under QRS complex. Am I clear? Now we'll see what is cardiac cycle. We'll see what is a cardiac cycle. Now cardiac cycles refers to all events associated with blood flow through the heart. Associated with blood flow through the heart. Associated with the blood flow through the heart. Now, what is a systole? Systole means nothing but the contraction of heart muscle. Systole means nothing but what, ma? Contraction of heart muscle. Then what is diastole? Relaxation of heart muscle. What is diastole? Relaxation of heart. Now we know what is the contraction of heart muscle. Contraction of heart muscle means systole. When the muscle is contracting, we call it as what? Systole. When the muscle is contracting, क्या कहते हैं इसको? Systole. क्या कहते हैं? Systole. Systole. अगर relax हो रहा है तो? Diastole. ఏమంటాం అమ్మా? Diastole. Relax అయితే ఏమంటాం? Diastole. Contract అయితే ఏమంటాం? Systole. Now we understood cardiac cycle. What is cardiac cycle? अंटर కదా? कभी आके पूछते नहीं cardiac cycle मतलब क्या है? क्या है? दो रहते हैं. सिस्टोल मतलब कंट्रैक्शन ऑफ मसल, डायस्टोल मतलब रिलैक्सेशन. हम जानते हैं क्या? अभी टी वेव कब शुरू होते जानते हैं, क्यूआरएस कॉम्प्लेक्स कब शुरू होते जानते हैं, और टी वेव कब शुरू. अभी एट्रियल डीपोलराइजेशन मतलब क्या हम जानते हैं, वेंट्रिकुलर डीपोलराइजेशन मतलब क्या हम जानते हैं, एट्रियल रीपोलराइजेशन मतलब क्या हम जानते हैं, और వెంట్రికులర్ రీపోలరైజేషన్ मतलब क्या हम जानते. తెలుసా తెలీదా మనకి? తెలుసా తెలీదా? ఏట్రియల్ డీపోలరైజేషన్ అంటే ఏంటో తెలుసు కదా? తెలుసా తెలీదా? ఏం వేవ్ వస్తుంది అక్కడ? పీ వేవ్. ఏం వేవ్ వస్తుంది? పీ వేవ్. క్యూఆర్ఎస్ కాంప్లెక్స్ ఇండికేట్ చేస్తున్నాయి వెంట్రికులర్ డీపోలరైజేషన్. ఏం చేస్తున్నాయి? వెంట్రికులర్ డీపోలరైజేషన్. మరి టీ వేవ్ ఏం చూపిస్తుంది? వెంట్రికులర్ డీపోలరైజేషన్. మనకి అంతా తెలిసింది. ఇప్పుడు కార్డియాక్ సైకిల్ లో సిస్టోల్ అంటే ఏంటంటే, డయాస్టోల్ అంటే ఏంటంటే, so contraction of heart muscle is termed as systole. Diastole means relaxation of heart muscle. Next slide. What is ventricular filling? Phases of cardiac cycle. What ma? Phases of cardiac cycle. So we have ventricular filling. We have ventricular filling. Ventricular filling అంటే ఏంటి? What do you mean by ventricular filling? Ventricular filling मतलब क्या समझ में आ रहा है? ventricular filling ये नाम सुन के तुमको क्या समझ में आ रहा है? मतलब ventricles में खून आ रहा है. Yes or no? Yes or no? अगर ventricle में हमको खून चाहिए तो ventricle contraction रहते हैं और relaxed रहते हैं. Relaxed रहते हैं. क्या रहते हैं? अभी रिलैक्स्ड वेंट्रिकल्स को हम क्या कह सकते हैं? सिस्टोल कहते हैं, डायस्टोल कहते हैं? डायस्टोल. अब ये क्या है? मिड टू लेट डायस्टोल मतलब रिलैक्सेशन शुरू होता है, हम इसको क्या कहते हैं? डायस्टोल कहते हैं. रिलैक्सेशन शुरू कितने टाइम में होते हैं? मिली सेकेंड्स. कितने टाइम होते हैं? मिली सेकेंड्स. मतलब डायस्टोल जब रिलैक्सेशन शुरू होते है थोड़े मिडिल में, जब मिडिल में तब हमको वेंट्रिकुलर फीलिंग स्टार्ट हो, तब हमको वेंट्रिकुलर फीलिंग ये खत्म होने के तक पूरा वेंट्रिकुलर फीलिंग हो जाएगा. వినడం చెప్తాను వినడం మన కోసం. ఇప్పుడు మనకి వెంట్రికులర్ ఫీలింగ్ ఎప్పుడు స్టార్ట్ అవుతుంది? ఇప్పుడు డయాస్టోల్ ఏమన్నామమ్మా? సిస్టోల్ ఏమన్నామమ్మా? ఇప్పుడు మనకి వెంట్రికులర్ లో బ్లడ్ వచ్చి చేరాలంటే వెంట్రికల్ రిలాక్స్ అయి ఉండాలా, కాంట్రాక్ట్ అయి ఉండాలా? రిలాక్స్ అయి ఉండాలి. అందుకే ఇక్కడ ఏమంటున్నాడు? డయాస్టోల్ అన్నాడు. ఇక్కడ ఏమంటున్నాడు? డయాస్టోల్. సో డయాస్టోల్ స్టార్ట్ అవగానే ఫీలింగ్ స్టార్ట్ అవుతుంది. సో ఎప్పుడు స్టార్ట్ అవుతుంది? మిడ్. ఎప్పుడమ్మా? మిడ్ అంటే డయాస్టోల్ స్టార్ట్ మధ్యలోకి రాగానే ఫిల్లింగ్ అనేది స్టార్ట్ అవుతుంది. డయాస్టోల్ కంప్లీట్ అయ్యే లోపల ఫిల్లింగ్ అనేది కంప్లీట్ అయిపోతుంది. ఫిల్లింగ్ అనేది ఏమవుతుంది? ఇప్పుడు డయాస్టోల్ అంటే ఏంటి? రిలాక్స్ అవుతుంది. హార్ట్ కొంచెం ఇలా రిలాక్స్ అవుతుంది అనిపించుకుని అలా రిలాక్స్ అయ్యి అంటే కొంచెం హాఫ్ టైం వచ్చేసరికి ఫిల్లింగ్ మొత్తం అయిపోతుంది. క్లోజ్ అయ్యేసరికి ఫిల్లింగ్ మొత్తం కంప్లీట్ అవుతుంది. ఇప్పుడు డయాస్టోల్ ఇప్పుడు సిస్టోల్ మిగిలినాయి అనుకోండి, వెంట్రికల్స్ ఏమవుతాయి? కాంట్రాక్ట్. వెంట్రికల్స్ ఏమవుతాయి? కాంట్రాక్ట్. సో వెంట్రికల్స్ కాంట్రాక్ట్ అంటే ఏం వాల్స్ ఓపెన్ అవుతున్నాయి? సెమీ లూనార్ వాల్స్. ఏం వాల్స్ ఓపెన్ అవుతున్నాయి? సెమీ లూనార్ వాల్స్. ఆ సెమీ లూనార్ వాల్స్ ఏమేంటి? పల్మనరీ సెమీలునార్ వాల్. సో ఇప్పుడు మనకి లెఫ్ట్ వెంట్రికల్ నుంచి ఎక్కడ ఏం ఓపెన్ అవుతుందంటే అయోటిక్ సెమీలునార్ వాల్స్. బ్లడ్ ఎక్కడికి వెళ్తుంది వెంట్రికల్ నుంచి? సిస్టమిక్ సర్క్యులేషన్ బాడీ. yes or no? yes or no? వెంట్రికల్స్ నుంచి ఎక్కడికి వెళ్తుంది? రైట్ వెంట్రికల్ నుంచి ఎక్కడికి వెళ్తుంది? लंग्स. पल्मनरी सेमिलुनर. अब सुनो क्या हो रहा है यहाँ पे, जब डायस्टोल हो गया मतलब पूरा खून वेंट्रिकल्स में आ गया. अब वेंट्रिकल्स में क्या शुरू होना है? सिस्टोल शुरू. अगर वेंट्रिकल्स में सिस्टोल शुरू हुआ तो वेंट्रिकल्स में क्या सिस्टोल शुरू हुआ तो सिस्टोल शुरू होने के बाद वेंट्रिकल्स क्या होते हैं? कॉन्ट्रैक्ट होते हैं. अगर कॉन्ट्रैक्ट हो रहा है तो खून को क्या होते हैं? खून बाहर निकलना पड़ेगा. कैसे निकलते? अगर राइट वेंट्रिकल से खून बाहर जाना है तो कौन खोलना है यहाँ पे? पल्मनरी सेमीलुनर वाल्व्स. लेफ्ट वेंट्रिकल में कौन खोलना है? आयोटिक सेमीलुनर. अब समझ में आया ना? अगर यहाँ पे वेंट्रिकल्स डायस्टोल चल रहा है, वेंट्रिकल्स क्या चल रहा है? डायस्टोल मतलब रिलैक्स हो रहा है. अगर वेंट्रिकल्स में खून वेंट्रिकल्स में आना है तो कौन कॉन्ट्रैक्ट होना है? आर्टरियम. दोनों एट्रियम हैज टू कॉन्ट्रैक्ट. एट्रियम రెండు ఏమవ్వాలి? కాంట్రాక్ట్ అవ్వాలా వద్దా? So when atrium contracts, ventricles are relaxed so that the blood which is present in the atrium is emptied into the ventricle. अगर ventricle contract हो रहा है तो वहां पे atrium क्या हो रहा है? रिलैक्स. जब ventricles relax, सुपीरियर वेना कावा इंफीरियर वेना कावा तरफ से खून वेंट्रिकल्स में आ रहा है, डीऑक्सीजनेटेड ब्लड पल्मनरी वेन्स की तरफ से, 4 पल्मनरी वेन्स की तरफ से लेफ्ट एट्रियम में हमको ऑक्सीजनेटेड ब्लड. Am I clear?
Yes sir.
Am I clear?
Yes sir.
Yes or no?
Yes sir.
Next. Ventricular systole, atria. Rising ventricular pressure results in closing of AV valves. Rise in ventricular pressure results in closing of AV valves. What is this atrioventricular valve? Right side atrioventricular valve enti? Oi. Atria ki ventricle ki మధ్యన ఉన్న valve కోసం మాట్లాడుతున్నాం. Tricuspid valve. ఏంటమ్మా? Tricuspid valve. सुनो. బ్లడ్ వెసల్ కి వెంట్రికల్ కి మధ్యన ఉన్నదాన్ని మనం సెమీలునార్ వాల్వ్ అని పిలుస్తాం. ఏట్రియో వెంట్రికులర్ అనగానే ఏట్రియం ని వెంట్రికల్ ని సెపరేట్ చేస్తుందని అర్థం. దేని సెపరేట్ చేస్తుంది? ఏట్రియం ని వెంట్రికల్. దేనమ్మా? ఏట్రియం. ఇప్పుడు మనకి ఏట్రియం ని వెంట్రికల్ ని సెపరేట్ చేసి వాల్వ్స్ ఏమున్నాయి? ట్రైకస్పిడ్ వాల్వ్, బైకస్పిడ్ వాల్వ్. బైకస్పిడ్ వాల్వ్ మనం ఇంకో పేరు ఏం పిలుస్తున్నాం? మిట్రల్ వాల్వ్. అర్థమవుతుందా? సో ఇప్పుడు వెంట్రికల్స్ లో ప్రెషర్ పెరిగింది అనుకోండి, when the pressure is built up in ventricles, who is closing means atrioventricular valves. Atrioventricular valves. Exactly. What are these atrioventricular valves? Tricuspid valve and bicuspid valve. What is the function of these atrioventricular valves? They facilitate the blood entry from atria to ventricle and they oppose the entry from ventricles to atriums. Yes or no?
Yes sir.
Do you understand my point? Yes. From atrium, blood is entered into the ventricle when this tricuspid valve and bicuspid valve are open. Now when ventricle contract, if the tricuspid valve and bicuspid valve is open, again the blood will go to we want the blood to go to atrium or we want the blood to go to lungs and body?
Lungs and body.
If the blood has to go to lungs and body, who has to close? What valves has to close? Tricuspid valve and what valve has to open? Semilunar valves. What are the semilunar valves? Did you understood?
Yes sir.
Yes or no?
Yes sir.
That is what here. So isovolumetric contraction phase. Ventricular ejection phase opens semilunar. What is this ventricular ejection? When ventricles contract, the blood is ejected out. The blood is ejected out. How the blood is ejected? From right ventricle, the blood is ejected into pulmonary artery through pulmonary semilunar valves. From left ventricle to the aortic semilunar valves through the systemic or the archa. Am I clear?
Yes sir.
Am I clear?
Yes sir.
Am I clear?
Yes sir.
Next slide. Now, isovolumetric relaxation, early diastole, when ventricles are getting backflow of the blood in the aorta and pulmonary trunk is, what will happen? Now, semilunar valves, they open when the ventricles are contracting. Yes or no?
Yes, sir.
When the ventricles are contracting, who are opening? Semilunar valves. When the ventricles are relaxed, from where the blood is coming? Atrium. So if the semilunar valves are open, blood which is ejected out, again the blood will enter into the ventricle. Yes or no? Yes or no? So semilunar valve has to close or open?
Close.
Who has to open here? Tricuspid valve. Semilunar valve and pulmonary semilunar valves are open. Again, the blood is re-entering into the. We want the blood to re-enter into the ventricle. We are ejecting the blood out. From where we want to receive? From atriums we want to receive. That is what this is saying. Do you get my point? Yes or no? The backflow of the blood in aorta and pulmonary trunk closes the semilunar. Now, necrotic notch. Brief rise in the aortic pressure cause the backflow of blood, rebounding of semilunar. కొన్నిసార్లు సెమిలునర్ వాల్వ్స్ లో బ్యాక్ బౌండింగ్ వస్తే కనుక మనకి డైక్రోటిక్ నాచ్ అనేది అపియర్ అవుతుంది. ఓకే, నెక్స్ట్ దిస్ ఈస్ ద ఫేస్ ఆఫ్ కార్డియాక్ సైకిల్. This is the phase of cardiac cycle. Now, when the first we have to think about heart sounds also. We have to think about what ma heart sound. So when the first sound first sound will come, when the second heart sound will come. So first heart sound is heard at ventricular depolarization. Is heard at ventricular depolarization. So QRS complex heart sounds will be. You can hear the heart sound at QRS. I'll describe you in detail about the heart sounds. Don't worry about that. Just this is for understanding purpose. Okay. At the beginning of the T wave, you can listen the second heart sound. You can listen the second. It is because of the closure of valves. Nothing but the closure of valve. What are the lub dub sound which you are hearing is because of the opening and closure of valves. We'll discuss that in detail. We'll discuss it. But when we check out with the ECG at QRS, when the QRS complex is beginning, here you can listen the first heart sound. When the T wave is beginning, you can hear the second heart sound. Am I clear? Am I clear?
Yes, sir.
Yes or no?
Yes, sir.
Next. So this is what the phases of cardiac cycle is. This is what the phases of cardiac cycle. Okay, listen carefully. I know boring on the man. Huh? But some of you are not listening. I feel like you people are having sleepy. Okay, you want me to play jokes or you want me to go with the content? Go with the content. You want jokes means this will become a stand-up comedian class. Yes or no?
Yes, sir.
So I want to be as a teacher. That's why I am teaching you continuously. Okay, listen carefully. So you take the heart. You take the
Heart.
How many chambers you can see here?
4 chambers.
What are those 4 chambers? Right atrium, left atrium, right ventricle,
Left ventricle.
Now, why this is blue color? Blue, right side is blue in color. Why the left side is red in color? Deoxygenated blood and
Oxygenated blood.
now, what is ventricular filling actually? We have seen it in words. I'll show you now in pictures. I'll show you now in
Pictures.
what is this ventricular filling actually? What was this? Ventricular filling. So ventricular filling is nothing but here ventricular filling mid to late diastole. Did I say it to you or not?
Yes, sir.
Mid to late diastole. So if ventricle has to fill, who must have blood? Atrium has to have, because from atrium only the blood will enter into the ventricle. Yes or no?
Yes, sir.
Through atrioventricular. Yes or no? Through atrioventricular septum. One side is having tricuspid valve, another side is having. Now see here, from atrium the blood is entering into the ventricles. You can see the second picture. Now atrium are getting empty and the blood is filled in the
Ventricles.
so by the time isovolumetric contraction begins in the ventricles, both the atriums are
Empty.
empty. So what is happening here? Ventricular ejection phase. Ventricular
Ejection phase.
So by the time ventricular ejection phase is beginning in the ventricles, here the atrium they started filling their blood. You can see a small amount of blood is starting to build up. So in ventricular ejection, what happened? The blood is pumped through pulmonary semilunar valves. It is pumped to pulmonary trunk and through aortic semilunar valves. It is pumped into. So here is there any blood present? Here is there any blood present? But by the time ventricular ejection phase began, they started to now ventricles started to get
Empty.
ventricles started to get
Empty.
atrium started to get refilling again. They started to get what ma?
Refilling.
So when the ventricular phase by the time ventricular filling phase begins here, the early diastole is beginning. Early diastole. So now here what is happening here? Ventricles are relaxed. Atrium started to get diastole. Okay, they are getting systolic. Now they are getting what ma?
Systolic.
Atrium is in systolic phase. Ventricles are in diastolic
phase.
When ventricles are in systolic phase, atriums are in
Diastolic phase.
ulta simultaneous. समझ में आया?
Yes, sir.
Class leader, member of the house, leader of the house. इधर ऊपर leader रखेंगे. Next. This is what the phases of cardiac cycle. This is what the phases of cardiac cycle. Now clearly, if you see here, these, amma, ఏమన్నా ఇబ్బంది ఉందా? వినండి. సో ఇక్కడ మనం ECG ఏంటో చూసాం. ఇక్కడ మనం ఏం చూసాం? ECG చూసాం. ఇక్కడ మనం గ్రాఫ్ చూసాం. ప్రెషర్ ఎంత ఉంటుందన్న చూసాం. ఇక్కడ ఏం చూసాం? ప్రెషర్ చూస్తాం. 40 mm of Hg, 80 mm of Hg, 120 mm of Hg. Yes or no? సో ఇది అయోటిక్ ప్రెషర్ అనుకుందాం. ఇదేంటమ్మా? అయోటిక్ ప్రెషర్. ఇది వెంట్రికులర్ ప్రెషర్. ఇదేంటమ్మా? వెంట్రికులర్. సో ఎంత వాల్యూమ్ వస్తుంది? ఏమొస్తుందన్న ఇక్కడ? వాల్యూమ్. ఎంత వాల్యూమ్ ఆఫ్ బ్లడ్ ఎంటర్ అవుతుంది? ఎంత వాల్యూమ్ ఆఫ్ బ్లడ్ అవుట్ అవుతుంది? సో ఇప్పుడు ఇక్కడ చూడండి. Atrioventricular valves. ఏంటమ్మా?
Atrioventricular valves.
సో atrioventricular valves ఎప్పుడు ఓపెన్ అవుతున్నాయి? ఎప్పుడు క్లోజ్ అవుతున్నాయి? అయోటిక్ పల్మనరీ వాల్వ్స్ ఎప్పుడు ఓపెన్ అవుతున్నాయి? ఎప్పుడు క్లోజ్. మీకు అర్థమైందా? అర్థం కాలేదా? అర్థం కాలేదా? సో ఇప్పుడు వినండి. వెంట్రికులర్ ఫిల్లింగ్ ఫేజ్ లో when we are talking about ventricular filling phase, what are the valves which are set to be opened? ఏంటమ్మా? atrioventricular valves. ఏంటమ్మా? atrioventricular valves. What are these atrioventricular? Now when the ventricular phase is begun, so ventricular filling phase is begun. When the ventricular filling phase is begun, what are the type of valves which has to be closed? What ma? Semilunar valves has to be closed. Now listen to me carefully. Now when the atrial contraction is beginning, when the atrial contraction is beginning means who is in relaxation phase? So what valves has to open here? Atrioventricular. They have to open or not? Yes or no? So when ventricular is in systolic phase, when the ventricles are in
Systolic phase.
that means they are getting what? Contraction. They are getting what ma?
Contraction.
Now what valves has to open?
Semilunar valves.
What kind of valves has to open?
Semilunar valves.
And what valves has to be closed? Atrioventricular valves. Atrioventricular
valves.
Hope you understood.
Yes, sir.
Closure of valves, closure of semilunar valves, closure of tricuspid valve or atrioventricular valves. Tricuspid valve by Pacific. Am I clear?
Yes, sir.
Am I clear?
Yes, sir.
In next class, we'll see what are the hard sounds. Okay. So mostly now I would like to end the class. Okay. When we start the next class, I will say you about the timings. Okay. What phase will take how much time? I will explain you clearly. Cardiac cycle. Okay. This is general physiology which I have said. When the P wave get excited, when the Q wave get excited, when the R wave will get excited, when the T wave will get excited, when the S wave will get excited. We have seen. Now we know where the node is actually AV node, where the impulse actually begins, how the conduction is going on. So you know the conducting system of the heart. Am I clear?
Yes, sir.
Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
So in next class, I'll try to show you table wise. I'll show you what are the timings of each phase. How much time is taken by atrium? How much time is taken by ventricle? How much time is taken? Entire what time it is completed, I will see. Okay. If not, just give me a moment. Just give me a moment. Time and time number.
11:25, sir.
Amma?
11:25.
Antena. Just wait, don't go. We'll see the class. We'll see the class. I'm not done yet. I'm not done yet. So, back to cardiac cycle. Yeah, keep it. Keep like this. Where is it? Where is it? Front. Slow. ఇంకొకటి ఇంకా నెక్స్ట్ ఇదే క్లౌచ్ నెక్స్ట్ కదా టైం ఎక్కడ పెట్టానమ్మా ఇంకా బ్యాక్ వెళ్ళి ఒకసారి చెప్తాను ఫిజియాలజీలోకి వెళ్ళిపో ఇంకా వెళ్తుంది ఇట్లా ఇంకా ఇదే క్లౌచ్ listen carefully. Now we have atrial events. We have what ma? Atrial. What are these atrial events? Atria has to contract, atria has to relax. If atria is contracting, this event is called as atrial. Atria contract అయితే దాన్ని ఏమంటాము? We have two types of atrial events, atrial systole and atrial diastole. If atria contracts, it is called as atrial systole. It is called as atrial systole. If atrial is relaxing, it is called as atrial diastole. Atrial diastole. Now exactly this atrial systole will last about 0.1 second. Will last about 0.1 second. Will last about 0.1 second. If not 0.11 milliseconds. 0.11 milliseconds. Now next one. Atrial diastole. What is this ma? Atrial diastole. Now this atrial diastole will last about 0.69, nothing but 0.7 seconds. How many seconds? 0.7. 0.7 seconds. 0.7. Now we'll see what is this atrial systole. We'll see what is this atrial systole. Now atrial systole. Atrial systole means nothing but the atrial muscle is getting contracted. Atrial muscle is getting what ma? Contracted. Now atrial muscle contracts and atrial pressure rises about 4 to 6 mm of Hg. Atrial pressure is rising about how much? 4 to 6 mm of Hg. With the rise in ventricular pressure about 7.8 mm of Hg, the atrial pressure will rise up to 4 to 6 mm of Hg. 4 to 6 mm of Hg. Now, whereas the left atrial pressure rises approximately to 7 to 8 mm of Hg. 7 to 8 mm of Hg. So it provides approximately 30% of additional blood into the in the atria and great veins. Atria and great veins. When so what is happening here? When the atrial muscle is getting contracted, when the atrial muscle is getting contracted, the atrial pressure is also rising. What is rising? The atrial pressure is also rising. So what is the pressure rise means here? Approximately 4 to 6 mm of Hg. Approximately 4 to 6 mm of Hg. So here the ventricular pressure is also rising up to 7 to 7.8 mm of Hg. 7.8 mm of Hg. So here atrial pressure rises up to 4 to 6 mm of Hg. How much, ma? 4 to 6 mm of Hg. So here right atrium is rising up to 4 to 6 mm of Hg. The left atrium pressure is approximately rising 7 to 8 mm of Hg. 7 to 8 mm of Hg. What it is doing? It is giving additional blood into the ventricle. It is giving what? 30% of additional blood into the ventricle. Now listen to it. Even though what kind of valves are present? Tricuspid valve is there, bicuspid valve is there, and also we have superior vena cava, inferior vena cava, which is coming inside. Superior vena cava, inferior vena cava. So they also have valves. They also have what, ma? But when atrium is contracted, little amount of blood is getting regurgitated. Little amount of blood is getting what, ma? Regurgitated. So great veins means these two we can call them as great veins. So here. If for semilunar valves are there for pulmonary valve and aortic valve, but here valves are present, small kind of valves are present. But due to the increased pressure, small amount of blood is regurgitated. Due to the increased pressure, small amount of blood is regurgitated. So here what it is saying, it narrows the orifice of inferior and superior vena cava. Inferior and superior vena cava orifice. Orifice is nothing but the openings. It is narrow, but due to the increased pressure, regurgitation of blood can occur into the great veins. Regurgitation of blood can occur into the great veins. Did you understand the point? Yes or no?
Yes.
Yeah, please. Narrowing the orifice of inferior vena cava, superior vena cava, and pulmonary veins decrease the return of venous blood, venous return to heart. What is happening here? Narrowing of the orifices of inferior vena cava and superior vena cava and pulmonary veins decreases venous return to heart. So this is what? Atrial diastoles. This is what? Atrial diastoles. Now listen. Sorry. Atrial systole. Now listen to me carefully. We have right atrium. So we have two openings present. These two are called as great veins. Now there is an orifice, superior vena cava orifice. There is an orifice, inferior vena cava orifice. So when the atrial systole is happening, here we have pulmonary veins. Now atrial systole means not only right atrium, even the left atrium is also contracting. Now this one is having 4 orifices open, 4 pulmonary veins. Here also 2 veins are there. Yes or no? Superior vena cava. So this orifice is larger. Yes or no?
Yes,
compared to pulmonary veins orifice. You can spot the difference here itself. Now these orifices are narrowed. So that means the pathway is narrowed. So when the pathway is narrow, can the blood re-enter? Yes or no? So it will prevent the entry of blood to the atrium when it is getting contracted. And also it will prevent the entry of venous blood from atria to veins. Am I clear? So this is what atrial systole is all about. Now what is atrial diastole? What is
Atrial diastole.
So during this phase, atrial muscle, now atrial muscle time, atrial systole time is about 0.1 second. 0.1 second. Now atrial diastole is about 0.7 seconds. It is about 0.7
seconds.
It is about 0.7.
7.
Am I clear? Am I clear?
Yes, sir.
Yes or no?
Yes, sir.
Yeah. Now we have to see what is atrial diastole. What is atrial diastole? So during this phase, atrial muscle relax and atrial pressure gradually increases. Atrial muscle is relaxing as well as pressure is starting to increase gradually. Pressure is starting to increase gradually. Due to the continuous venous return to drop to almost 0 mmHg at the point where the opening of AV valves. So what is doing here? Atrial diastole. When the atrial is in diastolic phase, these are relaxing. These are
relaxing.
So when these are relaxing, blood from superior vena cava, blood from inferior vena cava is entering into the atrium. Is entering into the
Atrium.
blood from pulmonary veins is entering into the Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
So when what is happening here, when the blood is completely filled, when the blood is
Completely filled.
they push these tricuspid valve and bicuspid valve respectively. That is how the valves are open, the blood is emptied. At the same time here the ventricular atrial systole actually beginning. Okay? So atrial diastole means relaxation. Atrial systole means atrial diastole means
Relaxation.
atrial systole means
Contraction.
so atrial diastole what happens? Blood fills. Atrial diastole what happens? Blood is filling in the both atrium. When the atrial systole actually begins, they both contract and the blood is emptied to. The blood is emptied to. Am I clear? Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
ఇద్దరికి బాగా కుదిరింది కనపడతలేదు నాకు చక్కగా మాట్లాడుకుంటున్నారు అదే చెప్తే ఓకే క్లాస్ చెప్తే ఓకే సీరియల్ చెప్పుకుంటేనే ప్రాబ్లం నెక్స్ట్ then the pressure rises again during this phase the diastasis and follows the ventricular pressure. So what are when now we have seen what are the atrial events. We have seen what are the
Atrial events.
What are the atrial events? Atrial systole and
Atrial diastole.
atrial systole and
Atrial diastole.
atrial systole lasts for about 0.1
second.
0.1
1 second.
atrial diastole lasts for about
0.7 seconds.
Now you have to understand one thing. Atrial systole is taking more time, atrial diastole is taking more time.
Atrial diastole.
So during diastolic what happens? The blood is filled into the both you're getting if the diastole of the atrium is getting larger, why it is getting larger means diastole phase why it is staying little more means there is a special node which is called as AV node. Conducting system of heart in that maatladutunnama. Yes or no? So AV node what it does, it delays the impulse. It delays the
Impulse.
So when the delaying of impulse is done, here the atrium, what happening? It is not directly going in. You getting my point? So what happens? The relaxation time also increases. The relaxation time is also getting
Increase.
so that the blood is filled. The blood is
Filled.
the blood is.
Filled.
Am I clear?
Yes, sir.
Listen to me carefully. Now, what are ventricular events?
Ventricular diastole.
Ventricular diastole and
Ventricular systole.
ventricular diastole and
Ventricular systole.
ventricular diastole and
Ventricular systole.
now ventricular systole lasts for about 0.3 seconds. Ventricular diastole lasts for
0.5 seconds.
0.5
seconds.
Okay. Yes or no?
Yes, sir.
Yes or no?
Yes, sir.
Now what is isometric contraction period? What is isometric contraction? What is ejection? Now ventricular systole. Ventricular systole is divided into two phases. Ventricular systole is divided into
Two phases.
the first phase is called as isometric contraction phase or isometric contraction period, and the second phase is called as ejection
Period.
So isometric contraction phase is or isometric contraction period is approximately 0.05 millisecond. 0.05 millisecond. And the ejection period is 0.22 millisecond. 0.22 millisecond. So both together will give us 0.3 seconds. Both together will give us 0.3
seconds.
Now what is isometric contraction period? What is isometric contraction? So we have to see. It is the first phase of ventricular systole and is the type of muscular contraction characterized by increasing tension without any change in length of muscle fibers. Without any change of muscle fibers. Now isometric contraction of ventricular muscle is also called as isovolumetric contraction. It is also called as isovolumetric contraction. So this isometric contraction, it begins when the ventricular systole is beginning. It begins when the ventricular systole is beginning. So here the tension is increased in the ventricles. What is happening here? Tension is increased in the ventricles, but there is no change of muscle fibers. But there is no change in the length of muscle fibers. The tension is increased, but the length of the muscle fibers is not changed. Now, what is this happening? Immediately after the atrial systole. Immediately after the atrial systole. So, atrial systole is finished means what will begin here? Atrial diastole. So, here atrial diastole is beginning means what will start here? Ventricular systole. Yes or no? Yes or no? See here. Immediately after the atrial systole, the atrioventricular valves are closed. These valves are getting closed. Atrioventricular valves are getting closed because here systolic phase has completed and diastolic phase has begun. Diastolic phase has begun. Now the atrioventricular valves are closed due to the increase in ventricular pressure. Due to the increase in what? Ventricular pressure. Now ventricle contracts. What happens now? Ventricle contract and as closed cavities in such a way there is no change in the volume of ventricular chambers. There is no change in the volume of ventricular chambers. Now what is ejection? What is ejection? Now due to the opening of semilunar valves, due to the opening of semilunar valves. Next picture ke log sir. Next. So due to ఇంకో పిక్చర్ తీసుకెళ్ళాము ఇంకా ఇక్కడ నుంచి ఇది కూడా వద్దు నెక్స్ట్ తీసుకెళ్ళి ఇంకా you look at this picture. Due to the opening of semilunar valves, the isotonic contraction of ventricles. What will happen? Isotonic contraction of ventricles. Blood is ejected out of the both ventricles. Blood is ejected out of the both ventricles. ఈ రెండు ventricles లో blood ఏమైనా కనపడుతుందా మీకు ఇప్పుడు? లేదు కదా? Blood is ejected out of the both ventricles. Hence this period is called as ejection period. Because this period is called as ejection period. Now ejection period occurs in two stages. Ejection. Now ventricular contraction period is ventricular systole is occurring in how many phases? Two phases. What is the first phase? Isometric contraction and ejection. Now we know what is isometric contraction period. So what is happening here in isometric contraction? The tension in the ventricle is increased, but the length of the muscle fiber is not changing. Now when we talk about ejection period, here whatever the blood that is there both in the ventricles are getting emptied into pulmonary trunk and aortic circulation. Pulmonary trunk and aortic circulation. Now this ejection period is called as ejection period because it is sending the blood out. It is sending the blood out. Actually, this ejection occurs in two phases. This occurs in
Two phases.
so what are those two phases means? First stage or rapid ejection period. Second one is second stage or slow ejection period. First stage rapid ejection period and second stage slow
Ejection period.
now, first stage starts immediately after the opening of semilunar valves. Immediately after the opening of
Semilunar valve.
during this stage, large amount of blood is rapidly ejected from both the ventricles. What are both ventricles? Right ventricle and
Left ventricle.
so during the starting phase, large amount of blood is ejected out. During the starting phase, large amount of blood is ejected. So it lasts about 0.13 seconds. It lasts about
0.13 seconds.
Second stage is slow ejection period. Second stage or slow
Ejection period.
now during this stage the blood is ejected slowly with much less force. Slowly with much less
force.
now here whatever the cycle changes are occurring first phase second phase it does not occur for 1 hour or 2 hour or 1 minute or 2 minutes. Everything happens in milliseconds. Everything happens in milliseconds. Everything is happening in milliseconds. So duration of this period is 0.9 seconds. Duration of this period is how much ma?
0.9 seconds.
Now end systolic volume. So what happens here? It is the amount of blood in ventricle at the end of the systole and the beginning of the diastole. So when the entire blood is emptied, so little volume is remain. Little volume is because by this time ventricular diastole is beginning. By this time ventricular diastole is beginning. So when the ventricular contract, the blood is emptied. This time ventricular systole begins, diastole begins. The blood started to enter from atria into the ventricles. Blood started to enter into the ventricles. So exactly before starting this phase, you call it as end systolic volume. You call it as end systolic volume. Now end systolic volume is the lowest volume of blood in ventricle at a point of cardiac cycle. So when the entire blood is emptied out, and the entire blood is emptied out, again slowly it has to fill. Again slowly it has to fill. Now exactly this end systolic point is nothing but where the less amount of blood is present in the ventricle. The point where ventricles are having very less amount of blood. The point where ventricles are having very less
amount of blood.
Am I clear? Yes or no? Yes or no? So this is what we call it as ventricular systolic phase. The ventricular
Systolic phase.
now when we talk about ventricular events, there are two types of events: ventricular systole and ventricular diastole. Now ventricular systole is occurring in two phases. First phase is isometric contraction, second phase is ejection. We know what is isometric contraction. Now ejection period is again divided into two types. First one is fast ejecting period, and second one is slow ejection period. First one rapid ejection period and slow
Ejection period.
once these two phases are completed, there is one point which is called as end systolic volume and systolic volume. So with this we have completed ventricular systole. We have completed ventricular
systole.
now in ventricular events what is remaining?
Diastole.
Ventricular
Diastole.
what is the time? 11:50. Okay. So we'll discuss ventricular diastole tomorrow. We'll discuss ventricular diastole. Did you understand the topic? Did you understand the topic?
Yes, sir.
Any doubts you can ask me. Another 10 to 15 minutes I'll stay back. You can ask me. Okay? Anyone who is having any kind of doubt, you can come. Okay?